What is going on? Germain and Craddock here with the Dr. Rises podcast, and I have a very special returning guest, Jessie Wagner here. And today we're going to be talking about Step 2 and Level 2. So that's USMLE Step 2 and COMLEX Level 2, talking about the differences between the exams, when you should be taking the exams, and kind of how you should be preparing for those exams differently than when we talked about Step 1. And particularly kind of the resources that you should be using, how you should be preparing for the exams, how your shelf or COMAT exams contribute to that, and then also when you should really start transitioning into more board prep style studying rather than studying for your COMATs. And then also how you can score as high as possible. So really improving your metrics so that way when you are applying for residency in whatever field you're interested in going into, you're putting your best foot forth and you're also giving yourself a platform that you're going to be successful at whatever you do moving forward. So Jessie, will you go ahead and introduce yourself?
Sure. Thanks for having me back. My name is Jessie, like Germain said. I'm a fourth year student at TCOM, and I am have applied for already family medicine residency.
Congratulations.
Thank you.
And I wish you the best of luck with
Thank you.
FM.
I appreciate it.
I know it's going to be, quite an arduous, application process, an arduous interview process, and I hope everything goes well.
I hope so too.
Yeah.
We'll see.
So with USMLE Step 2, COMLEX Level 2, so Step 2, COMLEX Level 2, or just Level 2 for short. So what are the kind of big differences for those exams? And then also kind of what are the differences between Level 1 and then Level 2?
Yeah, so starting with the differences between Step 1, Level 1, and Step 2, Level 2, the biggest difference is purely length, particularly for Step 1 versus Step 2. Step 1 was about 280 questions, 7 blocks of 40 questions apiece. Step 2 is pretty significantly longer at around 320 questions. So it's now 8 blocks of about 40. My test was 318 questions. It kind of just depends on how things shake out. Level 2 versus Level 1, they're the same length, both 352 questions, and there's really not a ton of difference in terms of formatting. The biggest difference overall between either Step 1, Step 2, Level 1, Level 2 is purely that it's very clinical, whereas Step 1, Level 1 was very much about the hard sciences, kind of more discrete, memorizable facts, pathophys, diagnostics. Level 1 or Level 2 and Step 2 are very much more clinical, so much more similar to what you're going to see on your COMAT or shelf exams.
So by clinical, give me an example of a patient presentation that you might see and what is a question like? Because I know, let's say, for example, in, let's say, Step 2, I'll have Leishman and it gives you kind of all of the presentations of that. And then you might talk about some of the pathophysiology behind it. You may talk about the genes that contribute to it.
Totally.
Obviously, that's not really the case when it comes to, because I've already done my family COMAT and I'm currently studying for my internal medicine one. Mm-hmm. Obviously, they're very different. You don't need to know the nitty-gritty behind it.
Not at all.
But you do need to know, kind of the medications that you're treating for it, kind of the, patient presentation, and then what else goes into that.
Yeah. The biggest thing that you're going to get asked on a Step 2 or a Level 2 is, what is the next best step? That is the most common question you're going to get asked versus, like you said, Step 1, Level 1 was here's all this information. What is the diagnosis? Or here's all this information and here's the diagnosis. Tell me about the pathophysiology or, what have you. That you won't see that kind of question as much on Step 2 or Level 2. You will sometimes get a nice little softball question where it's here's all this information. What is the diagnosis? That is not as frequent. And instead it's going to be a lot more of okay, what is the gold standard of diagnostic test? What is the next best step in testing or treatment? What are some adverse effects of those treatments? Things like that. It's a lot more second, third, fourth order questions on Level 2 and Step 2 than you saw on Step 1 and Level 1.
Yeah, I think I've also had a lot of, given this patient presentation, you would think like, okay, a CT is the best, but because of this presentation, it's like, oh, you can't use this test. I need to use ultrasound.
Yes.
Or if I'm using an ultrasound, what kind of ultrasound? Like all these little things that like contribute to alternatives, even though you may know the best one. I think I remember it's like, okay, well, just kidding, because they showed up with this, or because this patient, for example, is pregnant, we can't do this with their test because it's undue stress, or it would be a contraindication because obviously you could put harm on their baby. And there's all these other little things that even though you know the best one, it's like, just kidding, you need to know a little bit more than that too.
And on level 2 and step 2, there's a lot more focus on special patient populations. And like you said, like how do you address a certain issue from like a diagnostic or treatment standpoint in that particular population, whether it's like older individuals where you have to be really careful with certain medications due to Beers criteria, or if it's a pediatric patient, things are very different versus pregnant women. So yeah, there's a lot more focus on patient populations and just keeping their kind of limitations in mind when you're ordering diagnostic tests or screening tools or what have you.
Yeah, I had no idea what, Chad Vask was. I had no idea what SIRS criteria was and how often they use that. And then like, obviously, MD Calc is like, it's some godsend for that, because all these little things that like in practice, like a lot of the doctors and a lot of my rotations, they're talking about, but like they're also brought into USMLE and Amboss. And I think it's important that not only do I learn how to use those, but it's also important when it comes to like taking questions that I'm able to understand what those criteria, what those calculations are used for, because it can determine certain criteria of like how you treat a patient and then what other little things are relevant to that patient presentation.
Yeah. And I think something that's really difficult about step 2 and level 2 is that for step 1, level 1, you had 2 years of formal education in these topics. Like you had classes and exams and lectures that were provided for you. And that doesn't exist for studying for your COMATs or for step 2 or level 2. You kind of are on your own to use the resources that you find helpful for you, and then also translate that to like testing. So it's very different in that sense, is that there's no one holding your hand. There's no like provided guide for how to study or what to study. It's very much self-guided.
Yeah, and I know we'll definitely address like resources and all that, but I think that's where it comes into play, like asking your peers, asking your seniors above you what worked for them, how they studied for it. Because I know before we talked, actually in our last episode, I had never used Amboss before. I was like, it's whatever, no big deal.
And it's amazing, right?
Yes. Like ever since then, I was like, you know what? I'm spending $700. I'm going full send. It hurt. Like
it's like, painful.
It hurt a lot. But like it is such a useful, not only is it like a good question bank resource, but like I use it when I'm doing like differential diagnoses. I'm looking when I'm doing research for like a specific topic. I had on internal medicine, my first internal medicine at JPS, I had to give a presentation on hepatic cirrhosis, and it was alcoholic hepatic cirrhosis when you do paracentesis, and literally the entire presentation was Amboss.
Yeah.
It's just Amboss.
I use Amboss every single day. Like up to date in Amboss, I have 2 different tabs open usually, and usually use Amboss first because it's condensed really nicely. There's like pictures, there's tables.
It's easy. It's like more condensed and it's easier to pull
easy
what
to
I
navigate.
need to.
Yeah, exactly.
Up to date obviously is the gold standard, because like I had this when I was doing it was what was it? Someone was having it was either congested heart failure or they're having like some lung pathology. And I remember the guidelines were different than what they had on Amboss because it's a 2023 guideline. And so they had changed, obviously, and Amboss hadn't, but there's so many different things that they have. So it hadn't changed on Amboss. So like I didn't answer the question correctly that my resident asked me because I looked on that. So I think for me, up to date inherently is obviously the gold standard, but Amboss is way easier to navigate. And if there's little things that like are obviously changing because they change all the time in medicine, up to date is what you should stick with. But Amboss is so easy to navigate. And like you were saying, like I remember if I was looking at a lung pathology, I'm like, I have no idea what this looks like. They have the picture there.
Yep.
They have it annotated. They have it color coded. So like, hey, this is what you're looking for.
Yeah.
Curly B lines. Like I was like, oh, I actually know what that looks like now.
Yeah, it's great.
Yeah. And then with the differences between the exams. So for us at TCOM, I know some schools are different when they take step 1. So we take step 1 at the end of our second year. So you go into all of your coursework. So we have second pass for us, and then we have a dedicated board period at the end of it. And so by the time you're taking step, it's typically earlier on at the end of May, June, and then we have to take it before we start rotations, which is July 1st. So, or actually, sorry, not before rotations, before we have orientation.
Right.
So before orientation, but we start rotation July 1st. How is that timeline different for level 2 and then also step 2?
There's a little bit more flexibility in when you take level 2 or step 2, because you guys had classes up until or early May, and then you had to take it by like June 18th or something like that. You really only have a month-ish window in there to study for and take level 1 or step 1. For step 2 and level 2, it's kind of up to your discretion when you want to take it, as long as you take it by September. Obviously, September is a little late to be taking it because that's when applications are due, and you ideally want to have your scores back, not only so that you can submit it to programs, but also so that you can kind of use it to guide your application, which we'll talk about, I think, later. But I had people who took it like early June, depending on how prepared they felt throughout studying, from studying throughout the year, through end of July, early August. And technically you can take it later. It's just a little bit harder to do so when you're on like audition rotations or sub-Is. So yeah, the recommendation per our school is to take it before September. I took mine, and I think most people take theirs like mid to late July after your third year.
Because I know what we can do. So again, every school is different, so I think it's important to like kind of talk to your uppers and your peers depending, because for us, I know a lot of people like at different schools, they'll do sub-Is, they'll start in July because they finish rotations earlier on.
Yeah.
But for us, you have your dedicated short little period, but then they'll take their first rotation off, so they have a little bit more time. So that way they're going in at the end of July, they're starting their first audition rotation or their other rotations afterwards. And so I think that timeline varies depending on the school, not only, but also like how much time do you need to be prepared?
Definitely. Yeah, it's definitely very variable. Even within TCOM, when people were taking their tests, it's kind of, like you said, how much time do you feel like you need to prepare? What does your audition schedule look like? What specialty are you choosing that dictates how many auditions you have to do? And so for me, I wanted to kind of get it over with, and I feel like you don't need as much time for step 2, level 2 as you did for step 1, level 1.
Yeah. And I think, we'll talk a bit more about this in a bit, but the importance of, doing well on your COMSAE, your shelf exams, that directly is going to contribute to your ability to, not start from scratch. So you front loaded it. Obviously, if it's your first rotation, period 1, period 2, it might have been a while since you've seen it. But like, I know medicine pops up in family, it pops up in pediatrics, it pops up in OB-GYN. So like, you may not see specific internal medicine questions later on, but like there's still a little bit of carryover, and it does contribute overall. So, and then also you're practicing. No matter what, you're always doing practice questions. So the formatting, getting comfortable with questions, you'll have thousands of questions under your belt by the time you started it. Whereas like for us, I know when I started dedicated board studying, I had not done nearly as much as I've done now. And by the end of it, it was like 5,000 questions. And like by the time I finished, year 3, I have done plenty more, probably plus upwards of 10,000 questions.
Yeah, exactly. So it's very different in that way, because you really are studying for step 2 and level 2 throughout the year while you're on your rotations. So it's not as though you kind of start studying at any one time. You're studying throughout, and ideally those COMATs and shelf exams are helping you prepare for your step 2, level 2. You just might need to refresh a few things before you really dive into it.
So then I know for us, and I mentioned this in the video I did on taking step 1, is scheduling our exam. So we schedule it about 6 months out for step 1 and level 1. Is that also the case for step 2?
That's when most people try to start scheduling it. You don't have to do that. I mean, I know people who were kind of on the fence about whether they were going to take step 2 in addition to COMLEX level 2. And so they ended up scheduling theirs a little bit later and had no problems getting dates. So it's really up to you how far out. I scheduled mine end of January maybe, and then took it mid-July, so a good 6 months. But I did end up going back in March and kind of re-looking at dates and times to try to get them exactly where I wanted them, because when I first registered, there weren't necessarily the times and locations and dates that I was exactly looking for, and they open more throughout the spring, so there's not really any pressure to register that early. It's just kind of nice to get it out of the way and check that box and not have to think about it.
For us, when we were taking step 2, there weren't as many dates and they started getting filled up really quick.
Yeah.
But it did, by the time, you're a month out, a few weeks out, they did open up more because people were rescheduling. It was just a little nerve-wracking that I remember, I think I registered like 2 weeks after like the 6 month mark out. And I was like, oh, I can't find what I'm looking for. I was like, this is nerve-wracking.
You just kind of have to keep going back and looking, because originally my step 2, I only was able to find a date in Tyler, Texas, and that's like at least a 2-hour drive for us. And so I kind of decided, no, I'll just keep looking. And luckily in March, they opened a ton of Dallas dates, and I was able to get the date that I wanted at the time that I wanted in Dallas. So
good. And then, so we mentioned this a little bit. So because I know this is a current guideline. So the current guidelines are for people taking step 2s, you don't have to take step 1 if you're done level 1. And those are, again, current guidelines, apt to change, very likely could change. Who knows at whatever point,
who knows?
Or it could stay the same. That's up to the USMLE gods.
Yeah.
So for people that are taking level 1 or people that are, level 2, people that want to take step 2, who should realistically be looking at taking that exam that's going to, let's say, a DO school?
That's a good question and a controversial one. I think it really depends on your goals. So I applied family medicine. That was my goal from like the moment I registered for step 2. I knew that I was going to do family, which is not a competitive specialty. I did not need to take step 2. It would have been totally fine to take COMLEX Level 2. However, I knew that some of the programs I was really interested in, some of the more competitive programs, some more DO unfriendly programs, would want to see step 2. And so for that reason, I took it. And I think you should really think about the specialty that you're applying to. Obviously, if you're applying in a surgical specialty, you need to take step 2. Some of the other ones you could probably get away with just COMLEX Level 2. It's tough because we're in this weird transition phase where my class was the first class that had step 1, level 1, go pass fail. And so now it's very unclear how schools are using this information, or programs are using this information. It's unclear how they're filtering applications without a step 1 score. Presumably that just shifts it to a step 2 score that they're looking at more heavily. But I think generally it's a good idea to take both if you're able to financially, if your specialty requires it, definitely. And then I would also look into some programs that you're interested in. Just early on, just take a gander and see like, hey, what am I kind of looking for in a residency program? Because if you're wanting to go more of an academic setting, you probably need step 2. However, if you're looking in a more community program, you can definitely get away with COMLEX Level 2 only, not the surgical specialties yet again. Yeah. You need both.
I know. So at our school, basically they say don't take step. And I think it's not for the right reasons. They say it more so because it looks bad if people don't pass it. And unfortunately, like you're talking about surgical specialties, you basically have to. I think this is important where you take a lot of things with a grain of salt. When we have like our school saying don't take step, I'm like, well, don't take step because what? Like, I need more details. Like, I'm interested in a surgical specialty. There's no options. Like, I had one program that they happened to be like, oh, I don't really care about step. That's like an orthopedic program. Like, oh, I don't really care about step, but like, you need to do it because everybody else expects it.
Exactly.
And it's like an expectation in a competitive surgical specialty that you do it. Because for them, it's how are we supposed to compare you to all these other applicants that are taking step? Because COMLEX, obviously, it's just a DO exam. And so it's unfortunate that, in that case, like there's certain programs that may or may not because again, that's so program specific. So like you were saying, it's important to reach out to those programs to understand what their expectations are and to tailor your application and what you're going to do with respect to that, because there's no guarantees obviously when you take STEP or COMLEX, but at the end of the day, if you don't take that exam, you could be closing a lot of doors.
Yeah. And I think that's the biggest point here, is that especially in third year, you're still exploring a lot of things, and a lot of people don't know for sure what they're going to apply to by January or February when you're registering for your exams. Like, they might have a top two, but I think taking step two just keeps those doors open, like you were saying. And it's not, besides the cost and the time, it's not like you're requiring a lot of additional studying for step two versus COMLEX level 2.
Yeah. And I feel like for me, in that sense, that's where I would gear my studying more towards step two, because the COMLEX style exams are worded very particularly.
Yeah.
They're worded very particularly and peculiarly. Indeed. So like transitioning to COMLEX style studying, so like with TrueLearn, is easier than transitioning the other way back.
Absolutely.
Because I feel like you're playing more detective work with trying to understand the question stem rather than the question content.
Yeah.
And so in that sense, it's not necessarily it's a very different way of studying it, but you're just doing it slightly differently. And in that respect, so you took STEP, you took COMLEX. Which one do you take first?
Again, it doesn't really matter in the grand scheme of things. Most people tend to take STEP first, just like for step 1 and level 1. The reason being is that most people don't study for the OMM content throughout their like dedicated like study period, because it's kind of low yield for yeah, exactly. And so if you take step 2 first, the benefit of that is that you then have a couple days to like cram some OMM knowledge into your head and then take COMLEX. But realistically, you could take it in either orientation, and it wouldn't probably matter. It just kind of depends on which one you want to get out of the way first.
Because I had originally went to step 1 and level 1, I had scheduled step 1, then level 1, scheduled conflicts, and ended up being the other way around, and there's 7 days apart. And I feel like the 7 days I had way more than enough time, like probably a little bit too much time for study for OMM, and it was fine. Like it really didn't affect me that much. It was just more so like, all right, well, this is the hand I've been dealt. Let me do step afterwards, and I passed both. So
yeah, exactly. It doesn't really matter, but I think for convenience, most people like to take step 2 first.
So then when it comes to step 2, level 2, when do you realistically start studying for it?
Yeah, so I alluded to this earlier, but realistically, you're studying for it throughout the year, because studying for your COMATs or your shelf exams, that is studying for step 2. I did not really crack down on kind of more specific step 2 studying until around April for a July test date. And when I say I cracked down, I just started revisiting some of my earlier rotations. So I had family medicine and internal medicine first, just like you did. And those are the biggest component of step 2 and level 2. That content is a huge part of those exams. And so around April, I happened to be on an elective, so it was very nice because I didn't have another shelf or a COMAT to study for. So I used the time I would have been studying for that shelf, and I just dedicated it to doing IM and family medicine combined UWorld blocks. And that's really when I started shifting my focus away from kind of individually studying for COMATs, and tried to shift it more towards like, I'm going to start doing mixed blocks. I'm going to start focusing on the big picture of step 2.
Good. And then with respect to, I know we talked a little bit about the exam breakdown, how there's more questions. How are the breaks set up similarly to step 2? Do you have, I know with COMLEX you have to do 2 blocks before you get a break. With step, you can take a break whenever you want. Is it, well, you can't really highlight for COMLEX? I don't know why. That was like a whole other issue. I remember like the COMSAEs, all of the TrueLearn, like you have like a certain interface that's like normal, but then you decide to get to COMLEX and there's like, oh, let's just kidding. Let's change up the style that the exam's formatted.
Yeah, it's the same, essentially. So for step 1 and step 2, it's the same format where, oh, Ziggy, you just decided to stand. Okay. Big stretch. Okay. It's the same format where you can kind of take a break wherever you have a certain amount of bank time. I think it starts at 45 minutes, but you accumulate time in step 2, just like you did in step 1. So if you finish a block a little early, that gets added to your break time, and it's yours to use whenever you want. COMLEX is also the same as it was for level 1, where you have to complete 2 blocks before you can take a break, and you can't accumulate, you can't bank time. So you have a fixed amount of break time for each break, regardless of how rapidly you finished your blocks. Which is frustrating. The step one and step 2 layout is so much more conducive to test taking than COMLEX.
Yeah, I remember with COMLEX, I was really concerned about having like a bathroom attack at any point in that like basically 2-hour spell, because like, I mean, you never know, like you get nerves, you may have drank a little bit too much water during your break or coffee. Yeah. And that's like also like why I'm concerned about how much caffeine consumption I have because it's Anywho.
And the COMLEX level 2, I mean, there's 8 blocks of 44 questions. So the blocks are a lot longer too. So not only are you like not getting as much break time, but you have longer blocks back to back than you do for step.
Yeah, I remember leaving COMLEX. I was much more physically exhausted.
Oh, it's exhausting
compared to step. Like, not that step wasn't hard, and it's only for step 1. It was only 1 section less.
Yeah,
but it definitely felt like it was much more of a physical toll.
Totally.
Then I can't explain why. I know it was only 44 extra questions, but it just like I was exhausted.
I think it's because of the break setup. Because staring at the computer screen for 88 questions straight is really difficult. It takes a toll on your eyes. It takes a toll on your mental fatigue. And it's just hard to sit in those chairs with the big bulky headphones on. Those are just not comfortable environments to sit in for 2 hours straight.
Yeah. And I can't remember between Prometric and Pearson VUE, like the experience was quite different. Like with step, like the people for COMLEX were very much more like, whereas like for my step exam, they're like, oh, it's fine, you can go, take a break, grab some water, it's fine, oh, just come back. It's like, yeah, we'll check your IDs and your glasses like normal, but like they were very much more so relaxed with step, and that whole like testing experience with them was so much nicer that it's just like it's like one extra thing that's like makes the experience a little worse.
Yeah. And that doesn't change, unfortunately, for step 2, level 2. We didn't have our COMLEX level 1 was also with Prometric. So it was all the same for me. So this year, when it changed to COMLEX being administered by Pearson testing centers, I was flabbergasted. Every single time I walked in or out of the exam room, they had to look at my ears and look behind my hair and look at my socks and swab me down with the little wand. And I was like, this is time consuming. Like it takes a lot of time out of your breaks, and it's just also like, come on. Like
I remember I wore a shirt with a pocket, and then I had like other pockets.
Oh yeah.
And they were like, oh well, you need to run your fingers in there.
PSA: don't wear clothes with a lot of pockets to your level 2 exam, because you have to turn out every single pocket.
And then that's also when I had my hair was long, and I had it in a half bun, and they were like, oh, you still need to pull your hair. I'm like, dude, you can see my ears. There's nothing hiding behind it. It's like my hair's down. It was just like let's not go there.
Yeah.
So yeah, less pockets, testing experience not as great. And then also just the whole interface, because I know with COMLEX, so this was one thing that really frustrated me. It's like the strikeout and the highlighting feature. Like there was like a weird way to highlight, or you had to click highlight, and it just like did not work. And like even the short code key didn't work. It was like super weird. And like we had done all of our COMSAEs, we had done all of our TrueLearn blank, doing it a certain way. It's like, just kidding. Like the entire way that I prepared for studying for that exam to highlight like high yield stuff didn't work.
That also doesn't change. I am sorry to admit. Yeah, it's frustrating. It just is extra steps to highlight or strike things out, and it's not intuitive. And so I ended up not really using my highlight tool that much, just because you have to go up and click highlight and then drag it, and then it just takes more time than is necessary versus step where you easy peasy, just click and drag.
Okay, so not worth it. Good to know.
Yeah.
Unfortunate to know. Moving on to resources. So we went through, a huge fire list on the last video for resources for step 1. Transitioning to step 2, how do your resources change and what are you more so gearing your studying time to?
Good question. I think the biggest difference between step 1 and step 2, or level 1 and level 2 studying, is that in step 1 and level 1, there was a little bit more focus on outside resources. Like a lot of people reviewed Pathoma, Sketchy, in addition to, of course, UWorld or whatever question bank you chose. You had to rely a little bit more on outside resources to help fill in a lot of the content gaps. For step 2 and level 2, really question banks are pretty much sufficient. Like there's a much heavier focus on just hammering through practice questions and doing them as frequently and as much volume as possible. So the only real resource I used outside of UWorld was Amboss, not so much for the questions, just for the knowledge. And it wasn't so much that I was doing dedicated content review like I did for step 1. For step 1 from our last conversation, I would go through Amboss or First Aid or Pathoma, kind of block by block or system by system, and kind of review as a whole before I would dive into practice questions, which I thought was very effective for step 1. It's not so effective for step 2. It really just is about getting the repetition and the exposure to the types of questions they're asking you, because it's not like discrete factual based knowledge. It's more so like clinical reasoning skills. And so I used UWorld and Amboss simply for like looking things up, making sure I knew gold standard diagnostic tests, things like that. I did buy First Aid for step 2 and I opened it once. And I was a huge First Aid for step 1 fan. I just did not find it as useful for step 2, although I will say I got a question on my actual exam and I only knew the answer because of that one time I opened First Aid. So maybe it's worth it.
For one question.
For one question.
So you're primarily doing testing banks. So we're talking about Amboss knowledge. So for those of you that potentially don't know how Amboss knowledge works, can you kind of explain how that resource works or that side of Amboss is?
Yeah. So Amboss has 2 kind of components. There's the clinical, well, there's 3 actually. So there's the knowledge base where you have access to the Amboss library, which has a ton of articles where they have videos linked, just really, really helpful information. And then there's the question bank side of things. I didn't use the question bank side of things at all for step 2, except for their 30-day high yield prep, which I did for step 1 as well, which was just like 5 questions a day for 30 days leading up to step 2. So the knowledge side of things is really where I spent all my time. And that was really nice because anytime I got a UWorld question where I wasn't super satisfied with the UWorld explanations, because again, I'm not a huge fan of the UWorld explanations. I think they leave a little bit to be desired. They're better than TrueLearn. But oftentimes I feel like still I'm like, question mark. So I would kind of use Amboss as Google essentially and just like put my topic that I was struggling with or confused about into Amboss and kind of use the little bookmark pages they have within your article to navigate diagnostic testing, clinical features, treatment, just to get a good idea of like high yield stuff for that particular thing that I was concerned about.
So then you used UWorld exclusively as your question bank. Mm-hmm. Did you do any Amboss for like your COMATs or anything like that?
I did. So when I first started 3rd year, we did not have access to UWorld right away. I think we got access in like October, which was after my first 2 shelves essentially. And so my thought process at the time was like, well, I don't want to switch, in the middle of studying. I want to get into a groove and just try to like maximize my studying rather than having to switch in the middle. So I exclusively used Amboss and TrueLearn for my first 2 COMATs and shelves. Granted, I didn't use as much Amboss probably as I would use UWorld otherwise. And it works fine. It does. It's just not as effective for me anyway as UWorld. A lot of people really love the Amboss question bank and can have really good success. You just have to be really diligent about it. Because I think the UWorld topics are just a little bit more high yield than Amboss is. So for the first couple months, yes, I exclusively used Amboss and TrueLearn. And then I switched to UWorld after I was like, had to mentally prepare myself to go back to UWorld after step 1. And I was like, okay, once I felt mentally ready, I switched back to UWorld. And I will say my performance on shelves went up pretty substantially. So not to say that you can't be successful with the other resources, because you totally can. It's just for me, I think UWorld was just a little bit more high yield for me.
It's a little bit more on the nose, relevant to what you were doing. Yeah, because what did I do? I did all of for a family. I did all of Amboss and UWorld for both of them.
Oh, wow. You did a lot.
I know. So I did both of them, and I did Amboss first, then UWorld, and it definitely felt like, even though the material's similar, it definitely felt like there's still a difference between them, even though with respect to them, they're both, big question banks with, I think there was like 900 and another 1,000, with both of them between them. TrueLearn. So I've done TrueLearn for family. I am about to start TrueLearn for internal. So how is TrueLearn with respect to you studying? Because obviously we have a mandatory 120 and then a 40 I think it's a 40 question. So 160 questions, I think, that were required per block to do for the 8-week blocks. And then I think it's less for the 4-week blocks. How's TrueLearn?
TrueLearn is TrueLearn. I have had multiple people come up to me, like younger students, and say like, oh my gosh, I got this answer in TrueLearn. And then when I looked it up on Amboss and UpToDate, it was totally wrong. And I was like, yeah, that's about right. That adds up for TrueLearn. It's not the most reliable question bank. However, I will say that for studying for the COMAT specifically, I usually kind of quit UWorld in the last week or so. So the first 3 weeks or however many weeks of the rotation, I would try to focus exclusively on UWorld and get through as much of the bank for that particular subject as I could. And then in the last 4 to 5 days, I would just transition to doing TrueLearn questions, simply because the way they are worded is as equally confusing as the way they're worded on the COMATs. And so it kind of got my brain prepared for that like little mind game. Yeah. Yes. And that's really the only reason. They did have, for a lot of the OMM content, like obviously TrueLearn's really our only resource. And I do think they have slightly better, not better, but they just have a little bit more in terms of like musculoskeletal issues than like UWorld or Amboss has, because it is very much like OMM and PM&R type focused.
Yeah. So then you mentioned that for your last elective rotation, that you had started your dedicated board studying or transitioning slightly and reviewing family medicine, reviewing internal medicine. So when would you recommend someone make that transition, and then how should they begin their board step season?
Good question. I think, April was a good time to do that, simply because your load's a little bit lighter in April for most of us, at least those of us with a nice rotation schedule. So it's a good time to start that transition. I kind of transitioned by setting a goal for myself. So during rotations where I had a COMAT or a shelf to study for, my goal was always to do like 25 questions a day. And then I usually used the weekends to kind of split that in half and do like half of my study time was dedicated to that particular like rotation, whether it's OB or peds or whatever. And then half was kind of dedicated to mixed blocks. As the exam got closer, so around that April period, I started upping my question like goal every day to closer to 50. And then I would say, okay, I'll do 25 that are focused on whatever subject I need. So when I was reviewing IM and family, I would do 25 like specific to family or specific to IM. And then I do my other 25 as a mixed block. And then as I got closer and closer and closer and was no longer having to study for shelves, of course, I was like increasing my count. So then I would say 75 questions a day. Did that happen all the time? No. but I would just, sort of kind of change the goalposts a little bit as we were getting closer, and then just totally started incorporating mixed blocks. When it came time for like my dedicated to start, which I took like 4 weeks of dedicated essentially. We have 2 weeks off that we get as TCOM students. And then I took the first period of fourth year off as an optional period to study. And I took my exam about halfway in the middle of that off period. Mm-hmm. So I had a total of 4 weeks. And during those 4 weeks, I exclusively did mixed blocks for as many questions per day as I could handle. So usually try to get 80 to 120. I felt like volume was not as important for this. I mean, it is important. But for step one, I was trying to do like 120 to 160 questions a day. And these questions are just a lot harder, I think, in the terms of like, there's not necessarily an obvious right answer. Like there's not one gene that you can pick and it's like a slam dunk. Oftentimes you're like, oh, do I pick a CT or do I pick an ultrasound? Like what is best for this patient? And so it just requires a little bit more thought process, I think. So I was doing a little bit fewer questions for step two.
So then with that in mind, you're looking at the difference between the questions or how many you're doing questions. So because you're doing, UWorld basically throughout the year, mm-hmm. By the time you get to dedicated, you have not necessarily used all of your questions, but ideally would have gone through quite a lot of them. Mm-hmm. Because I think with UWorld, it says there's 4,000 questions, but because they're tagged with between multiple, mm-hmm. Subspecialties. So if I do IM questions, I do family or ambulatory questions as well. So did you reset your UWorld, or how did you go about, once you had gotten to questions you had realistically already seen in previous blocks?
Mm-hmm. I did not reset my UWorld simply because I spent a good chunk of first semester just doing Amboss and TrueLearn. I didn't get through a ton. I mean, I got through a lot of UWorld questions, but I definitely didn't get through all of it before my dedicated period started. So I think I had only completed maybe 40% of UWorld by that time, because I also wasn't doing every single UWorld question for each COMAT or shelf. I was kind of doing as many as I could. Usually got through at least half, but not all of it. And so, I was about 40% of the way through UWorld. So I didn't reset mine. A lot of people who had done UWorld the whole year and had done every single question for every COMAT or shelf, they did reset theirs. It totally depends on where you're at. I didn't personally feel the need to go through it twice. Like by the time my dedicated was over, I think I had done about 80% of UWorld. That's a lot. That's a lot of UWorld. And so for me personally, I definitely didn't feel like it was necessary to reset them. I also kind of have one of those memories where it's like why I can't use Anki is I remember questions very specifically, like very, very well. And so I don't know how helpful it would have been because I feel like I would have been cheating myself out of seeing those questions. If anything, I would have done my incorrects again.
Yeah, I know because I've done questions, not necessarily for our COMATs, but I've done questions I've seen before when I was doing TrueLearn. Mm-hmm. So for family medicine, I did TrueLearn. And I was like, well, let me go ahead and do my incorrects. And then I would get the questions right, and I didn't even read the stem.
Exactly.
Just because I was like, I recognized the question stem and what they're asking, and I just would search and boom.
That recognition is strong.
I would say 75% of the time I'd get it right without really reading the question, just recalling the question. And so I think it was unfortunate in that respect, but I think because we got UWorld a lot earlier than you did. I think we got UWorld maybe 2 weeks. I think I waited for the first half of family to finish because that way I could have it till my dedicated would be over, because we only get I think a 360 or 355 days of UWorld.
Exactly.
And I was like, well, I don't want to have to pay for more UWorld afterwards, so I timed it so that way I would have UWorld at the end of it. But it was just one of those, when I was doing those TrueLearn questions, like I'm not learning anything.
Yeah.
I'm not like testing myself on my gaps. I'm testing myself on my ability to recall this, this question I might have seen, in 4 weeks ago, but still like I'd seen it, and it was easier to like recognize what they were looking for, not because I became better, but because I'd seen it before.
Yeah, that's how I felt too. I imagine if I had started UWorld way back in July, would I have remembered those questions? Probably not. but because I started it a little bit later, they were just a lot fresher to me. And so I didn't feel the need to reset. And I think it's going to depend on where you're at in the bank. Obviously, if you finish 80% of the bank by the time you dedicated comes around, you might have to reset it. But I don't think it's necessary to do well. I did very well in step 2, and I didn't finish UWorld, and I didn't reset my bank. So I don't want anyone to think that you have to do 10,000 UWorld questions to be successful.
So then, for example, let's say someone was in that situation. Would you recommend they switch to Amboss, or how would they navigate that? So that way, if you have 4 weeks of dedicated and you're not really learning from your questions, what would you think would be a good idea?
I would start by doing your incorrects and see how that goes. Because I do think doing your incorrects, you can still learn from them, because a lot of times when I would do incorrects, I was like, okay, I know that the answer is not, what I put before. And so that kind of narrows it down. But it also helps you to review, like, what was I thinking at that point and why was it wrong, which is an important part of the learning process. So you could try switching, but I generally think that once you know what works for you, you should do it. You should not try to switch your studying methods at the last minute because anyone tells you to, or because you're not sure what to do next. Like, do what has worked for you. Like, don't fix what isn't broken. And so I would, just do the incorrects, reset the bank and see how it goes. And if it's not working for you, then you can try something else. But I wouldn't necessarily jump ship to another question bank, because UWorld, it is the best. Yeah.
So then we talked about you transitioning into dedicated, doing like 80, 120 questions a day. How did your dedicated period switch, when you're closer to about like a week out or a few days out?
Yeah. So with step 2, I took a lot more practice exams than I did for step 1. I think for step 1, I took maybe 3. I was trying to take 2 a week for step 2. Simply because it gives you the NBME forms are more accurate to the test than UWorld is. And so basically I'd also use it as like a cheat day. If I was feeling sick of UWorld, I'd just be like, I'm going to do an NBME form today, because they're a little bit easier and also a little bit more like reflective of the test often. So that was pretty much consistent throughout the 4 weeks of dedicated, about 2 practice exams per week. A week out is when I started simulating full-length tests. So prior to that, I was primarily just doing the NBME forms or the UWorld self-assessments, which are usually 200 questions, if not a little less. Some of them are 180. That is not a full-length test by any means. So like I said, step 2 is 320-ish questions. COMLEX Level 2 is 250 or 352 questions. So those are really long exams. Those are like 9-hour exams. And a huge part of test taking is building the endurance to sit there and be mentally sharp for that long. So around a week, maybe even a little earlier, like a week and a half, 2 weeks out, is when I started simulating full-length exams. And I didn't do it immediately. I didn't go from doing 200-question practice tests to doing 350-question practice tests. I would kind of do 200 on an NBME form, and then do a block or 2 on UWorld, and at least get me to the 280 mark. That was like a full-length step 1. And then definitely by the week out, I was trying to get up to that 320, 350. Simply to make sure that I could sit there and be mentally sharp and engaged for that long. And I think that's really important. And I know a lot of people don't agree and they don't do it. But when it came to test day, the test day did not faze me, because even though it's long and it sucks and it's brutal, I was not fatigued. in the middle of the test. I was not fatigued by the end of the test. Like, I was approaching every single block with like what felt like a pretty fresh mind, except for that last block, which no matter how much practice, that last block is just brutal. So I really think that in that last week, try to focus on like the fatigue element or the endurance element. And then of course, a couple days out, just like for step 1, there's a free 120. Everyone should take it. It's very high yield. It's free. There's really no excuse not to. And it's a nice little break. So I took my last full length test on like a Friday, I think. And then I took free 120 on a Monday, reviewed it that day. And then my exam was on a Wednesday. So I took the day before completely off of studying, which again, I'm a huge advocate of that because your brain needs rest. Your brain needs to like solidify all the things that you've been shoving into it without its consent for the last month. So I took a rest day and then big test day.
So then with respect to, that rest day, that balance, so roughly about how many hours a day were you studying? What were you doing for breaks wise? And like, let's say if you were trying to build in some, reprieve, some rest, time to work out, time to just like cook dinner, how are you kind of managing that?
That's a great question because I think that's really important. I don't think you can learn well when your body is not like thriving. So to be honest, like I was probably only studying like maybe 8 hours a day, sometimes longer, of course, and sometimes way shorter. Like there were days where I just felt like I couldn't hack it. And on those days, I think it's really important to just like listen to what your body's telling you and just change it up. Like there were days that I was like, I am bombing UWorld right now and nothing's registering. I'm not reading these questions. Like this isn't productive study time. And so on those days, I would like switch to something else and just be like, you know what, I'm going to do my Amboss 30-day high yield stuff, or I'm just going to focus on reviewing blocks of questions today and make sure I'm doing a really thorough review. There were some days that I would just use the NBME forms instead of like a formal practice test. I would just kind of go through it very casually as practice questions, just because that's a little bit easier on your mind and your body. And there were days where I studied for like 4 or 5 hours and then would take the rest of the day off to like, I like to cook. So I'd cook a good meal or like, go get some outdoor time and get some sunshine and go for a walk or go work out or whatever. Obviously, that's going to be different for everyone and different depending on what your like goals are. Sometimes you will just have to grind it out for 12 hours and it's going to suck. But I do really think that it's important to keep in mind that like nourishing your like body and mind is equally as important to your studying process as like sitting in front of UWorld and doing 120 questions a day.
So for those of you that don't know, like an NBME form is basically, I don't know how many are there 10 of them for step 2?
There's actually a lot. They have just discontinued a bunch. So right now on the NBME website, I think there's up to 14.
There's 14. Okay.
14 was new this year. The older ones are not as ideal, not as accurate to the new test. So when I was studying, the rumor was that like NBME forms 9 through 14 were particularly good, and especially like 10, 11, 12. Like those ones were very high yield.
Yeah, because the NBME post forms that you spend, like $60 per form?
Yes, they're expensive.
So $60 a form, it's the 200 questions. Obviously, you're doing, it's another added cost. So, like, I think that's the other aspect of this whole equation. So step is $700?
Yeah, $695, I think.
$695. So $695.
Siggy wants to say hi.
Oh, it's fine. So, $695. $60 per form number, again, an added cost. Then obviously, if you're taking your step somewhere else, that's another, additional cost. If you have to get a hotel or you need to rent a car or, whatever. I know some people for step 1, at least, they had to drive, I think they spent overnight, in somewhere that was like 2 hours away.
Yeah.
It was just like another thing. So I think it's unfortunate. Like it's not just the exam, then there's other things, but I think the reality is those form numbers can be invaluable because UWorld, obviously those questions are very hard.
Very hard.
And for me, especially with step 1, UWorld was, here, and then TrueLearn was down here, and then STEP was somewhere a little bit below UWorld, like a step down. Yeah. And it's great for practice, but then when you're taking those form numbers from NBME first step, it's just like, okay, well, those are just a little too easy, like especially comparatively to the exam. Was that the same case for step 2?
I felt like the ones that I took, which I think I took 9, 10, 11, 12, and I did not take 13 or 14. And I took UWorld Self-Assessment 1 and 2 as well. I felt like they were pretty accurate to step 2. UWorld Self-Assessment 2 in particular is supposed to be extremely high yield in terms of scoring. So a lot of people kind of saved that to take towards the end of their dedicated study period to get a better idea of what their score would be. The same is true for NBME Form 11, I believe, is those are both highly correlated to your actual testing score. And so I really did feel like they were pretty accurate. I scored 2 points higher on the actual test than I did on my last NBME form. So pretty strong correlation there.
Good.
Yeah.
And then with those exams, so for step 1, then the form numbers that were related to step 1, they give you a % chance of passing.
Yeah.
So you're like, let's say you score, I don't know, like 60%, your chance of passing is, let's say, like 89% or, whatever. How is the scoring for the NBME form numbers for step 2?
They actually give you a 3-digit score. So it's very nice. It's very convenient. You don't have to do all of that nonsense where you like go plug in your % correct into some like random calculator on Reddit to try to figure out your projected score. They give it to you, and it's very convenient. And like I said, I think it's very accurate to what the actual test is scored like. So I found it very helpful.
Good. Yeah. So I made a Excel spreadsheet that I was able to like track my logs of all of my exams, all my UWorld blocks. And then also I've made those calculators plugged into there just so I could like correlate to a 3-digit score.
Yeah.
And it was all over the place. But like we were talking about earlier, whenever I started feeling bad, I could see my numbers like going down on UWorld. And I was like, it literally told me, like, my scores were telling me when I need to take a break. And so, like, for me, it was, obviously there's the quantitative way of saying, hey, like, you're burning out. My numbers are doing, like, absolutely, like, I'm doing poorly.
Yeah.
But also, like, from the feeling aspect of it, like, I understood, like, when I was doing poorly. And then now, so you're taking the form numbers for NBME. Did you do any COMSAEs from the NBOME?
No.
No COMSAEs.
I did not. They give us one for free, and if you could take it.
You're not required to take it?
You're not required to take it for step 2, which is nice. And some people did take it just to get an idea of what it was like. Oh, you know what? I take it back. I think I did take one, but I didn't take it seriously as like a seated formal like practice and exam environment. It was one of those days where I was like, I don't want to do anything. I'm feeling burnt out, but I still need to study. So I just kind of went through it like more of in a practice question kind of mindset of like, I'm just going to go through it and see, what's what and what the deal is. So I think I did do it actually, but there are 2. They give us 2. And I did not do the other one.
Yeah. I remember for step 1, we had the mandatory COMSAE that I did. And then I think I was like freaking out for some reason, like mentally, I was like, I don't know if I'm going to do well. And I bought a second one, and I was like, you know what? That was a waste of money. Cause like I scored really, really well on it, all things considered. And I was like, I could have done something else that day, but it was nice because I had the peace of mind.
Yeah.
The peace of mind was helpful, but again, it's such a different exam compared to STEP that it's hard. So kind of switching a little bit gears, talking about, the grand scheme of things when it comes to like getting your score back. So, worst case scenario, let's say, you either didn't do as well as you wanted, or potentially you were interested in doing a more competitive specialty, and then you get your score back. Kind of what kind of takeaways would you do for that, for someone that maybe needs to switch gears, maybe needs to go after something slightly more attainable with their score, or potentially what they can do that like helps them set themselves apart in lieu of that score?
That's a really tough question because I think it depends on so many factors. I don't think a step 2 score, it's tough because now we don't have step 1 scores. It used to be if you had a step 1 score and a step 2 score and you did better on one than the other, they kind of balanced each other out, maybe gave you a little bit more room for, not failure, but a little bit more room. Yeah, exactly. Now we only have one, and so I do think there's a lot more writing on step 2 than there was previously, and I do think programs, it's really the only numeric value they have to filter applicants by, and when you have 1,000 applicants, how else are you going to kind of whittle that down to a reasonable number of applications to review? But I will say, I think it depends on the program. Like we were talking about earlier, if you are applying to an academic program, they're going to care about step 2 scores a lot more probably than other programs. It also depends on the specialty you're applying to. Again, surgical specialties that are highly competitive, that number matters a lot more than others. So I do think you should look at your application as a whole and kind of say, like, do I have a lot of strengths elsewhere? Like, I don't have any research on my application except for like a case report or two. Because I don't like research and I don't want to do it. But if you have a ton of research that is like really good, strong work, and then you have a lower step 2 score, like those things might kind of balance themselves out. Same thing if you have a ton of volunteer experience or a ton of work experience or just like a really unique life story, that might give you a little bit of an edge. But the problem is, again, that filtering criteria. Like you have to be in a position where they're looking at your application deep enough to see all of those other things. And right now until this application season is over, we don't really know how programs are going to do that effectively without a step 1 score and only a step 2 score. So it's hard to say what to do exactly, but I think looking at yourself as a whole and saying like, okay, what strengths do I bring? How are my grades? Because if you have really strong grades and then you pass step 1 and then you have like a more average step 2 score, you're not necessarily counted out. Like the average step 2 score these days it's high. It's like, I think for my test, it was 247. It's a high average.
Yeah, it keeps going up.
It keeps going up. It was probably 248, I think, for other people who tested around my same date. So like that's a great score. And so if you're scoring average, but then you have all of these other things, like keep in mind that your average score is still good. And yeah, kind of have some perspective with that. Like 247 is nothing to like, shake your head about. As far as pivoting goes, it depends on what you're trying to pivot to. Some specialties like family medicine and internal medicine are going to be really easy to pivot to because they have much lower like thresholds in terms of step 2 scores. They also are not as big on research. They also are not huge on like, have you shown dedication to this specialty throughout your life? Whereas there are certain specialties like neurology, which is something I was considering before family, where like the most important thing to them is that you've shown like consistent dedication to the field. So keep that in mind as well, as if you are in a position where you have to pivot entirely to specialties, which hopefully no one is in that position, but it does happen. Those things are things to consider. The other option is you can always dual apply. It's not a bad option. It gives you a little bit of a backup and also still lets you like shoot for the stars and see where you land. But I won't say I'm like a professional in answering this question because I'm applying to family medicine. So
no, I think the only unfortunate thing with, I mean, obviously dual applying is a very great option in that case where like you could still match, like no matter at the end of the day, you can still match. Yeah. The only unfortunate part is that when you get your letter Monday, it says you matched. You don't find out till Friday to what specialty you matched into. Which is that whole process is, I'm sure, nerve-wracking. And I've heard all sorts of stories of people that like that whole week period is basically like a blur because of just the stress and, the compensating for said stress. So with that in mind, so how can, for example, I know you've done some audition rotations. So how can those audition rotations kind of help you, maybe not necessarily like, overcome a bad step score, but how can that help you in the case of, maybe your steps 2 score may have not gotten you in front of that program, but how could it help you get your foot in the door and then also impress them with your work ethic, with your ability to actually function, outside of a standardized exam?
Yeah, that's a great question. And I think auditions are really important, especially for more competitive specialties, for that very reason, is because there's so many applicants, and especially if you don't have a super strong like academic history or super strong testing history, they can actually spend that month getting to know you and know how you interact with patients, how you interact with the team, like what kind of qualities you show in terms of leadership, dedication, like timeliness, like all the things. And those are huge. Like residents and program directors, I think above all else, like if they know that you work really well as a team and that patients really love you and that you're willing to like learn and work hard, that can overcome a lot. So I think auditions are really, really helpful, even if you're not applying to a competitive specialty. I did 3 auditions for family medicine, and my goal with that was not so much to like overcome a test score or like, whatever. It was more so to kind of suss out the programs and what I was looking for, because that's also a really important part of the application process, is figuring out what you are looking for in a program. Because when someone said that to me the first time, my like first week on my audition, they were like, "What are you looking for?" I was like, I have no idea. Like I have a very, very high level idea of what I'm looking for, but as far as specifics, like I don't know. Now that I've done 3 auditions and have seen 3 different programs in action, I have a much better idea of exactly what I'm looking for. And I think that's really, really critical for the applicant. So it's very helpful for us as applicants, and it's very helpful for the programs to get to know you a little bit better. It just gives you a leg up in pretty much all respects. So I think do auditions if you can do them. They are expensive to go, especially if you have to go out of state or just out of the city. Very expensive. They can be stressful to set up. But I think they're very valuable, and you can get really, really strong letters of recommendation out of them, which is the other thing to consider if you're trying to overcome like a more average or a lower step score than you would hope for, is that your letters of recommendation are going to be hugely critical. And so having strong letters is super, super important, and you can get really strong letters from auditions.
Yeah, I know with orthopedics, so we're basically, for us at TCOM, you're basically doing 6 audition rotations on the audition trail. Here at TCOM, because we have no real DO or traditionally DO residency programs other than JPS, you're basically rotating out, all across the country. And for them, and this is what I've heard from a lot of residents, from a lot of people that are on the audition trail, it's as much of a way for them to feel you out as it is a way for you to feel them out. And it's, are you a good fit for this program? Are you going to put in those hours? Are you going to work hard? And for them, a lot of these programs have told me, it's like, look, as long as you meet our bare metrics, that's fine. Our auditioners are who we bring in. Yeah. The vast majority of the people that, especially for orthopedics, is like most of the people, the residents that we match are people that auditioned here because we know what we're getting. We've basically done a 1-month interview with these people, and I know, the qualities they bring. I know what they're willing to do, what they're not willing to do. I know if this person is someone I want to grab a beer with after work, and do I want to take call with them for 5 years or not? And so I think the audition, and I know for family medicine, it's not necessarily as common to do auditions, and it's less of a, for orthopedics, basically it's required. Yeah. And it's not necessarily required for family medicine, but I think there is definitely value in, going out there and putting yourself in front of these programs, because like we talked about this before we started recording, is you really don't know a lot about a program from just their website. And obviously you can talk to, the residents, you can talk to ideally, people that have gone there before, maybe rotated or matched there that are, maybe have gone to your school and maybe a little bit more candid, but it's hard to really understand what a program's all about until your feet are in the door.
Yeah. Absolutely. Like I said, I think everyone should try to do at least 1 or 2 auditions for that pure, simple fact of like getting to know the programs, what you like, what you don't like. It also helps you generate a lot of questions come interview season. Like, I had no idea on my first audition, people kept asking me, like, what questions do you have? And I kept telling them, like, I don't even know what I'm supposed to be asking. Like, I know the canned questions that everyone asks, like, is the program receptive to feedback? Like, give me an example of one improvement that has been made based on resident feedback. Those are all very canned, generic questions. But as far as questions that are important to me specifically, I had no idea until I started doing my auditions. And now I know that I need to ask about, like, hey, what opportunities do you have to be involved in specialty clinics? What opportunities do you have for procedures? How much OB exposure are we getting in this program? Like, there are a lot of very specific things that I've learned that I'm interested in that I can now go to programs and say, tell me about these things, because I need to know if I'm going to go here, or like if I'm going to rank you, I need to know how you like stack up to my needs.
Yeah, of course. And so kind of, wrapping everything up, do you have any other, grand parting words of wisdom?
I think my biggest comment would be, before you start studying for step 2 or level 2, think about your goals as far as your specialty, your career, what kind of vaguely environment you want to be in, community, academic, what have you, and get really clear on your goals, and then use that to set a score goal. I think having a score goal, a specific numeric value, is really important when you're step 2 studying, because it can really direct like all of your studying, and it can tell you exactly like where you're at. Whereas with step 1, you didn't really have that because there was no score. There was no number. Your goal was just to like get a % passing that was like high enough. And that's not it's not a good goal to work off of. Like, it gives you some motivation, it gives you some direction, but not a ton. Whereas when I picked my goal score, everything I did like was in service of trying to get to that score, and like that guided my studying a ton. That guided how many practice tests I did. And so, think about your goals as a whole. Think about your career and what you want out of it and what you want out of residency, just vaguely. You don't have to know all the details that we've just been talking about. And use that to kind of guide your score, because I think that'll just give you a little bit more of a concrete goal and something to work towards than just being like, I don't know, I'm just going to do well. Like, what is well for you? How does it get you to where you need to be?
Yeah. So I think that's, a very important takeaway, because obviously when you're starting your, let's say your form numbers, is how far are you, especially early on in dedicated, it's like, how far am I from my goal? Mm-hmm. Because naturally during, not necessarily dedicated season, but during your rotation season, you have your COMSAE that you're studying for, and obviously doing better contributes to that, and allows you to have, I think, having a higher starting point means you have less of a gap to fill.
Yeah.
And so doing well on your shelves, doing well on your COMSAE contributes to that. But inherently, your ability to do well is going to kind of determine, how much of that gap you can fill and how much you need to fill. And then are you able to get to where you want to?
Yeah.
Based on the goals that you've actually set.
Yeah. And I would start thinking about that pretty early, like as early as March or so, maybe April, just so you can take a really early practice test and see where you're at. And then that'll tell you exactly how much time you need to spend studying and how you need to like kind of format your dedicated period. I think it's at the beginning of May, the first week of May, Amboss does the same thing they did for step 1, where they offer a free practice test for anyone. You don't have to be an Amboss subscriber or member. And I think it's 180 questions or 160 questions, and then they do give you a 3-digit score based off your performance, and that's a really good way to see early on how you're doing compared to your goal and kind of what you need to shoot for and how you can arrange your studying accordingly.
Great. So I think that's going to wrap everything
Yeah.
USMLE step 2, kind of gearing your rotation life for the better part of a year, contributing to how you're going to go into step 2 and level 2, and then also what you should be focusing on during dedicated, so that way you can ideally hit the ground running and then make sure you're stepping your best foot forth. So thank you so much for coming, Jessie.
Yeah, thanks for having me.
Thank you so much for watching. If you haven't done so already, go ahead, please like the video, subscribe to the channel. I'll put your socials in the bio and description down below.
Great.
And I'll see you in the next one. A bientôt.